Hello and welcome to the third episode of the AI Oncology Revolution. I'm Dr. Arturo Loaiza-Bonilla, and I'm here with Dr. Chinmay Jani from the University of Miami, a place that I used to call home as well. I used to get trained as well as a fellow many years ago. So I'm glad to see some other you ones. So you power for all of us here. So can you tell me more about your current work? It's so nice to have you here.
Thanks a lot. Thanks a lot for having me over here. AI in medicine and AI in oncology, as I've been saying in the recent time, is no more thing of future. It's already here. Whether we are talking about in precision medicine, whether we are talking about in patient care, whether we are talking about in clinical research, artificial intelligence has completely embedded. And I guess one of the best example was that this year in ASCO, when we were submitting abstracts, there were separate sections for AI abstract submission for each subcategories as well, whether it was lung cancer, GU cancers, and so on and so forth. So similarly, here in University of Miami and Sylvester Comprehensive Cancer Center, we have started working on different artificial intelligence-based projects as well. The projects are evolving into patient care, into documentation. So I'm currently one of the trainee champion for Suki, which is our dictation app. Along at the same time, we are also looking into artificial intelligence in various different analysis and clinical decision making. We have an upcoming poster at ASCO, which I'm happy to talk about eventually as well, and looking into how clinical decision making can be changed and evolutionized using AI as well. And then using AI's help in various different meta-analysis, network meta-analysis, and so on and so forth. And most importantly, artificial intelligence can be extremely helpful in medical education too. So those are some of the aspects that we are currently working on over here.
Okay, no, that's great to hear, and kudos to all of you guys there. I'm proud of the work that Sylvester has been doing. It's great to hear that because when I at the time I was there, I was used to be called I was the techie fellow because I was all into AI, but there was really no opportunity to really explore that further. So I'm glad to see you actually doing it. So thanks for that.
No,
Uh,
and
so yeah.
no, one thing I would mention in the same way as you were saying techie, so I'm currently chief fellow, and in the chief fellow, every Friday when I'm handling the didactics, I have to make sure that I use my techie tools to make sure that the computer is working and then all the screen is working properly and Zoom is working. But now techie is no more just related to establishing Zoom. It's way beyond utilizing AI notes in Zoom as well and so on and so forth. So I hear your thoughts.
Excellent. So, well, in today's discussion, we always want to be talking here about practical uses, right? So, what are the things that now University of Miami and Sylvester Comprehensive Cancer Center are focusing on? And I would love to hear specifically about each one of those projects that you are all working together there. I know, Gilberto Lopez and Steven Neimer and all these folks who were there to really make research a very straightforward thing for everyone at Sylvester. But uh, how do you use these tools first of all? And like, what are the things that you already have deployed? And can you tell me more about the projects that you're currently working on? I would love to hear that.
So I think so. If the immediate tool that has really helped and revolutionized patient care, I think so is one of the Epic app, which is probably available at multiple different centers as well. And the name is Suki, and I think so it has really made a huge impact in patient care, in day-to-day patient care, I would say, in dictation. And it's very interesting that when we keep the Suki on while we are in a patient scenario, and obviously we have to take ethical permission from the patients that we are using AI for note dictation, it catches the exact information which is needed for that patient care. So if there is a patient who has lung cancer and we are talking about EGFR mutations, we are talking about different lines of therapy, and if we have discussed those things, it will catch up exact those information for the HPI as well as in assessment and plan as well. We can still talk with the patient a lot about his family, where did they recently travel. Even though it will gather all those informations, it would not put all those information immediately out in the note. So it selects what information is pertinent for the patient care. And this has helped a lot because now you are writing a note in real time. And more important than that, what used to happen is whenever a physician is trying to be really efficient and want to finish dictation, want to finish writing different orders or write in different information for on an email, we always used to type and look at the patient at the same time. But it's very difficult to completely concentrate on a patient. Now, with the help of such AI tools, you can just listen to patient as everything else will be taken care by AI. So I think so that has made a huge impact for patient care as the first tool to begin with.
Yeah, and Suki is one of those vendors for those who the in the audience is one of those ambient AI tools that we have available. So many of them they had to be native to the EMR. So it's been as far as I know, I have no knowledge of them in terms of like knowing the founders and whatnot, but I know it's been there for a while. So and Suki means beloved in Japanese. So I guess you love it already. It's part of that. So
I
uh,
didn't know it's Japanese term.
yeah, well, Sukiya means like to love or beloved, right? So it's one of those tools that we always want to use in ambient AI. So many of them, Epic and Athena and others. So it's good to hear that. Um,
And even
so
today, they implemented utilizing Suki for when putting orders. So when we write down and when we say that order CBC or order CT scan, it can now automatically put those orders as well. I have yet to use that as it was just implemented today, but it seems very exciting.
Yeah, and I think we had a prior conversation in the prior episode exactly for the same idea that we would love to have at least orders put in place that we can confirm following the conversation. So I think it's just one of those steps that we're taking on using these ambient scribes and tools to really benefit our workflow, hopefully. So no, that's great. So I have heard from prior conversations with you that also you have some research on using large language models for analysis of clinical decision support or case reviews. Can you tell me more about that to some extent?
Yes, would love to. And one of this project is actually going to be presented at ASCO in ASCO 2026 in Chicago. So I can briefly mention about it. Cannot delve a lot into the results, but happy to chat with you about the results after ASCO too. Or at ASCO if you're around, and I'm sure you'll be in Chicago as well. But about this project, so we are lots of different LLMs are now able to give us information about patient care. What next treatment plan to be there? What next treatment to be selected? In the past, when we entered into medical school and when I started going into my clinical rotations, my senior residents at that time always used to say that Dr. Google is a big doctor around in the world. And you have to always double check what Dr. Google is saying because many different people will come with Dr. Google's recommendations as well. However, now it is currently changed to Dr. ChatGPT or Dr. Claude or Dr. Copilot, Gemini, etc., etc. And based on this, Dr. Lopes and I, we came up with this idea to evaluate what these LLM models are helping and how much are they helping. So we had looking into concordance on different decision making based on case-based scenarios on how are different LLMs giving us information, whether they are enough concordant with expert opinion or they are discordant, and in what different settings are this concordant and discordant depending on case scenarios. At the same time, AI LLM models are now also utilized in various different tools like ASCO AI tools, which are available as well, particularly just for physicians. And physicians now, instead of going through purely NCCN guidelines and identifying exact different case scenario, they can put this case information in ASCO AI tool or even open evidence. And there are various many more evolving. And probably by the time this video will be out, there will be probably two or three more tools available already as well. But in these tools, again, they utilize various different underlying LLM to modify it and then put it in a case-based scenarios too. So we evaluated all these different LLM tools in non-small cell lung cancers in patients who have EGFR mutation positive and identified different concordance and discordance between that.
Okay, well, we're looking forward to hearing more at ASCO. Interestingly enough, I mean, I'm just going to do the to the horn here. I'm the champion of the AI community of practice, and we're going to have a big session on Sunday during the ASCO meeting, May 31st from 4:30 to 6 at the room S103. So looking forward to seeing you there and others, and we'll be talking about these abstracts and beyond. So looking forward to see a lot of folks there talking about these exciting developments.
I do have it in my calendar, so I will be there.
Super. And so moving on other projects that been working at University of Miami. So can you tell me more about this meta-analysis? You were mentioning something like that earlier in our prior conversations.
Yes, so for this meta-analysis and network meta-analysis, or like just the regular systemic meta-analysis as well as NMA models, we are collaborating with one of the company named Laravel AI, and we are utilizing their platform as well on identifying different patient scenarios, focusing currently on lung cancer, thoracic oncology, and then identifying cross-trial comparison as well, using their existing platform. Because as we already know that cross-trial comparison is extremely difficult. And there has never been a great tool for doing cross-trial comparison. Meta-analysis as well as network meta-analysis is probably one step beyond than even regular meta-analysis, which has helped so far in scientific literature as well as in oncology literature. So for that, we are trying to utilize if AI can help us identify as well. And AI can help us in multiple ways. It can certainly help us do the analysis itself of the meta-analysis, but it can potentially also help us identify individualized patient data as well. With a caveat that this individualized patient data is a created patient data from the existing trial curves which are already there. But still, based on the current scenarios, it is one of the tools which can help us identify what treatment would work well for which particular patient in which particular part of the country or in the world sometimes as well, depending on the genetic history, depending on family history, or depending on comorbidities. So that's what we are currently looking on as well. There has been a constant debate about how to utilize artificial intelligence for different statistics. So I had done some biostatistics courses in the past and have some experience in doing and utilizing various different softwares. So what Dr. Lopes and I, as well as our entire team here in thoracic oncology, our thoracic working group, we want to see how reliable can AI be in different analysis. So we are also doing some of the projects and looking into its concordance with a biostatistician, and how much can we rely on, and how much can we reduce the workload for biostatisticians as well. So that's a really interesting thing that we're trying to see. And hopefully, if we can come with a really good pipeline, it can help us significantly in improving the existing literature more speedily as compared to in the past.
No, that sounds very interesting and exciting. Yeah, I'm familiar with the Laravel AI. I know Bruno very well. And for those who don't know him, you're gonna see him in every single conferences with his team, always wearing these purple caps,
Purple
and
hat
and the tiger, right? So
and the tiger.
yes, no, he's a great guy and doing a lot of interesting work using AI for literature reviews and always checking for sentiment analysis on social media. So checking what happens on online across every single conference. So I'm glad that you're working with him on that sense.
And we
Um,
plan to take a picture together in his typical jumping pose style at ASCO. So much more to see at ASCO.
Okay, I would love to look forward to seeing that picture once you have it. Certainly he will try to get the same with me, but I'll see. I'll try if I can escape that. Awesome. So, okay. So moving forward, I know you're working also on some clinical trial matching at your institution. So, as you know, I'm very passionate about trial matching. I think that it makes a complete sense to right now build versus buy. Even though I work, I co-founded a company that is focused only on that, but I think it's fully commoditized. So anything that we should be doing, you should be helping any patient, no matter where they are, to find clinical trials. And I'm glad that you guys are doing this. Most recently, I published something about neurosymbolic architectures where I'm combining LLMs plus, decision deterministic tools for that purpose. And I think there's going to be an abstract in ASCO from a team in Europe, kind of doing the same approach, kind of and they kind of like highlighted my work. So I was like, shit, awesome. But so what is your approach to trial matching at University of Miami, and tell me more about that work?
So yeah, so University of Miami is trying to evolve and focus on a lot of artificial intelligence. So why I'm saying that is, so this year's research day or that Department of Medicine at University of Miami focused on a lot of AI, and they had a separate competition called Shark Tank competition, which was giving a pilot grant to early career trainees and early career faculty. And then the focus was purely on artificial intelligence. That grant should focus on utilizing AI as a tool and implementing them in various different patient-based scenarios or various different research scenarios. So I was really honored to be at this competition and receive one of the Shark Tank and a pilot grant for that. And we're going to utilize this grants on various different terms for all the different meta-analysis that I mentioned, identifying different subgroup analysis as well, and then identifying various different IPDs or utilizing LLM for different decision making. Why I'm mentioning that is that one of the potential objective of this is also to identify and see how can we use different existing tools or newer developing tools in clinical trial matching. So University of Miami and the AI department within the IT section are working on some of the in-house tools as well. I cannot take any credit for this because it's completely built by, in fact, by our IT team as well as by the AI team in collaboration with the community outreach team at Sylvester Comprehensive Cancer Center as well. And then they're trying to identify various different clinical trials as well as various different algorithms, which would first of all help us identify best trial matching internally from Sylvester and then also help us understand whether the patients would be eligible for various different phases of trials as well, whether phase one, phase two, phase three, etc., etc. As different phase would have different stringent eligibility criteria as well. At the same time, Dr. Lopes and I, we are also looking into different models and different existing tools outside of university as well, where we can help and collaborate utilizing these different models in clinical trial itself and clinical trial matching in existing clinical trials or upcoming clinical trials too. There are some of the models which have been developed here in Florida as well as at different parts of the country, and we are trying to see which one would be the best for identifying patient scenarios in existing clinical trials which are already ongoing at Sylvester.
Excellent. Well, I'm looking forward to seeing that work. And if there's any way I can collaborate with you guys, happy to lend you that. I'll always show the model as you see fit. I think that that's something that we can all work together to make it better.
Agree.
Um, so in terms of, governance and whatnot, is there like something that is happening at the University of Miami as a whole in terms of how we use an AI, or is still, there's different degrees of evolution in the use of AI in different institutions. So are you seeing that this is just an emerging thing that you're just trying to validate? You feel that the maturity level is there, or there's still room for opportunity to work and optimize further?
So I would give that answer based on a trainee perspective as of now.
Hmm.
And why I would say that is so we had recently organized and collaborated with our it was a Department of Medicine and Department of School where they took a 1 hour session on how to utilize artificial intelligence in clinical research. And that included a dedicated aspect or a dedicated presentation just on ethics of utilizing artificial intelligence as well. As you mentioned earlier in our conversation as well, that AI is a very helpful tool to be as a friend and not completely take over or not completely rely on it. Because if you're totally utilizing AI for your clinical research and completely relying on it, there are, first of all, various different hallucinations already happening. And then second thing is you cannot completely claim that it is your own project because that came through AI and AI has learned through various different aspects as well. So we had this dedicated training for fellows, for residents, as well as for medical students too. Going a few years back, I was chief resident up at Mount Auburn Hospital and Harvard Medical School. When we had and as a chief resident, we took a medical education fellowship at Mount Auburn and Harvard Med, where there were two dedicated sessions just utilizing upcoming AI models. And I still remember this is now 3 years or 3.5 years back when the first time I looked into ChatGPT and how can ChatGPT be utilized for medical education as well, whether we are trying to create different case-based scenarios for preparing content for education. So again, trying to give an example about non-small cell lung cancer. If I'm trying to create different case scenarios which can help me give information to patients, or it can help me create different PowerPoint from the existing literature that I have developed. It would reduce my time to prepare all those things and rather help me focus more on dedicated content creation rather than focusing a lot on this tech stuff. So those all aspects have been extremely helpful, and we are trying to implement similar things here at university as well. Regarding governance and regarding on ethics, I think so there are various different sessions which are constantly being organized. And I think so as the guidelines will keep on evolving, there is always going to be more and more room on improvement on those things.
Excellent. And well, and I think you just brought up a very important point is the part of the training, right? So I when I trained many years ago, there was no AI content, of course, but I think about it at a time when technology was emerging, when I was a fellow, and it was, for example, next generation sequencing and umbrella and basket trials. Those things were completely new. That now they're every day, and fully affordable. Now you can do next generation sequencing, whole exome sequencing for $100 in your kitchen. So hopefully the same happens with AI. So do you see a need for more robust curriculum on the use of artificial intelligence for trainees, particularly in oncology fellowships?
100%. And that's why my program director, Dr. Sharma, and I, we have implemented currently 2 or 2.5 sessions, I would say, focusing on utilizing AI on in medical education for hematology and oncology, as well as on clinical research. A second poster that I'm going to present at ASCO is showcasing our novel Hemong bootcamp. I would say novel is not because it's a novel information, it's the existing information just delivered in more 101's way. Because many times as a Hemong fellows, when we're coming from internal medicine, it's a huge giant leap when we are coming from just medicine to Hemong. And we are directly starting to talk about various different IM power or keynote trial or flora, mariposa, etc., but rather to know that when to do an NGS testing, as you just mentioned, and it's a constantly evolving thing. So in such bootcamp sessions and various different one-on-one sessions, we took help of AI as well to identify what would be the best case scenarios to be discussed, what would be the ideal content to be not missed, and how could it be delivered in a more interactive fashion. Because just purely delivering a PowerPoint-based lecture is going to reduce concentration of the fellows and trainees, and rather making it more interactive is always going to gain attention as well as gain more interest in this discussion as well. Second thing was recently utilizing various different available LLM models for PowerPoint presentations or preparing your journal club discussions or identifying similar different articles through citations, but in a more robust way utilizing AI. So for this, we took a session as well. So we had recently a drug discovery workshop, which was organized at Sylvester and University of Miami in collaboration with another corporate company. But in this, we had around 35 to 40 minutes to showcase the work which we had started doing from around 9 a.m. till like 2 p.m. to prepare the slides, showcase all the different drug models which we had hypothetically created, and prepare the slides for a final presentation for the entire faculty who are going to be there. Doing this entire presentation in 35 minutes for like an 8 hour of work that we have done is almost impossible if you're going and doing in the old conservative way. But that's where we utilize various different LLM models to prepare this PowerPoint based on the content that we had created. And it saved a lot of time for us. And now all the fellows, whenever they are preparing the journal club, they take help of this. And first of all, it improves the content quality. It reduces their time in preparing the content rather to focus more on reading different and newer trials and cross comparison. And in each journal club, we always request that each and every fellow at the end should focus on, if you are going to do this trial, how would you create this trial? And where would you go and ask for a grant if you want to create this trial? AI helps a lot in those ideas as well. So that's where we are trying to incorporate. But this is what we have tried doing it in this year itself. But doing it in a more standardized way, in a more organized way in future will improve the outcomes even further.
Yeah, no, that's extremely well taken point. I use multiple agents and multiple AI tools for different use cases as well, depending on what I'm seeking. And I actually learn a lot. To see is more like a companion to teach me stuff, but I do the research first, and then I get them to
Exactly.
summarize it for me so I can really use it appropriately. And I think the point that you're making is across all our professional education, whether you are just going to be a community practitioner who's just going to be focused on patient education, and or you're going to be full academician. Interestingly enough, I remember from University of Miami, I went directly to faculty at Penn,
Oh, wow.
and it had to be a completely different culture, right? Like just the way that every place teaches is so
System works.
different, and you're meant to be professor, right? From day one,
Yes.
you are like assistant professor, as if actually that just because you graduated that made you an expert in teaching someone, and you're not. Even folks who are full professors, sometimes they haven't learned the ropes because they just had a style. So that's why I did a master's of medical education just for that. But it's now old fashioned because I was not in the era of AI when I went through that. So I'm still a continuous apprenticeship in that era. So I appreciate your point in that continuous learning using AI for that purpose in medical education. Um, all right, so I think this has been a very good conversation. So just to wrap it up, you told me a lot of good stuff that you see is the future of AI, particularly around for trainees and beyond. But is there anything that you feel you're most excited about in AI, in oncology and beyond that you want to share for the audience so we can have a follow up on this in the future?
Yes, certainly. And then just wanted to reflect on one thing which you mentioned as well, that creating content for patient education. And just giving a shout out to one of the other collaborators as well. I'm collaborating with the Grace Patient Education Network, and they are utilizing artificial intelligence to create content for patient case scenarios. So like patient-facing information. But then a physician or an oncologist is checking it to make sure that this is correct or not. So this is again one another tool or one another way of utilizing AI. And then AI is becoming now a more and more conversation in not only just medicine, but also in business aspect as well. So I was recently at Johns Hopkins Carey Business School where we had the similar conversation on how can AI be helpful in healthcare, clinical research, and in future of precision medicine as well. So when you are mentioning about summarizing, I'm reflecting the same conversation that we had over there. I think so. The most exciting part I'm looking forward is utilizing and identifying what tools will help us most from AI, artificial intelligence, in advancing precision medicine in oncology. Whether we are talking about AI tools and various different meta-analysis that we talked about, or identifying AI tools in identifying the best biomarker, or developing newer biomarkers, which has already happened in different ASCO presentations even last year, as we already saw, or utilizing AI in advancing clinical research in more quicker way as well. Along with all that things that AI is already doing in improving patient care, whether it's in patient workflow, whether it's in dictation, whether it's in nursing workflow, so on and so forth. So I think so AI is going to utilize it in multiple different aspects. What I am most excited about is how will it improve the precision medicine aspect of oncology care.
Excellent. Well, extremely well said. Thank you so much for the chance to talk to me about your experiences and the use of AI. You indeed are part of the AI Oncology Revolution, and I'm excited to see how you continue to implement those tools in your learning and in your research, and happy to have you back in the future. Thank you so much.
Thank you so much for having me once again. And I'm looking forward to the presentation at ASCO at your panel.